So hello to everybody. So Leonardo da Vinci was born on April 15 in the year 1452. And each year, on the same day, the Italian Reserve Day in the world is celebrated. And Leonardo da Vinci is also well known in Malaysia, since the Italian embassy with the National Art Gallery has organized in 2019 an exhibition Leonardo Opera Omnia, which was a great success in terms of public attendance as well. And as a sort of a legacy of Leonardo, nowadays, Italian science and Italian researchers are worldwide recognized as an excellence. Just a few words about me before starting. My name is Nicola Bianchi. I'm a diplomatic counselor in charge of the scientific and technological relationship between Italy and Malaysia, and as well of those between Italy, Singapore, Brunei, and Indonesia. The Italian embassy in Kuala Lumpur is organizing today an interview with a brilliant Italian researcher who has been working in Malaysia for over the last 20 years. Given the pandemic, unfortunately, we are forced to do this interview online. And our guest, I'm very pleased to introduce him, is Professor Enrico Magosso, who is now senior lecturer of the Faculty of Pharmacy of University Kuala Lumpur. And you can see from the background, he's now in his laboratory in the university. And Enrico was born in Milano, Italy, and he graduated in pharmacy from University of Pavia, which by chance is also my hometown. So I'm very pleased about that. He started his scientific interest with research in pharmaceutical chemistry. And after being awarded a European Union scholarship, he moved to pharmaceutical technology at the School of Pharmacy in London. And after a few years working also with the pharmaceutical industry in Italy, Enrico joined University Science Malaysia in 2002, so exactly 20 years ago, as a researcher. And after he got the PhD also there. And Enrico has a wide range of expertise related to the complete pharmaceutical cycle, from novel drug formulation and delivery system to in vivo studies and to over 100 of clinical trials. And furthermore, he has been consultant for several private, public company and for government. So we can start this interview with the first question. The first question is about personal aspect. So, Enrico, what triggered your decision to move to Malaysia about 20 years ago? And can you also make a comparison of the research environments in Italy and Malaysia? Thank you.
Very good. Good day, everybody, and thank you, Mr. Nicola, for the kind introduction. Yes, it has been a long journey. Coming from Italy to Malaysia. Actually, everything started a bit by chance, to be very frank. But the interest for science and technologies always been there. I was lucky, I have to admit, because I had a very good mentors, University of Pavia, which is my alma mater. And so I had the chance to do my internship there, and for about 1.5 years internship. So my degree actually was very long, but and after that, so I'm in the laboratory of Professor Caccialazza, and then I applied for a scholarship. I was selected actually, luckily even in the case, to join the School of Pharmacy in London, which is one of the prestigious universities. And there actually I moved to pharmaceutical technology. So it was a bit once back in Italy, I couldn't find a research job in the industry. So it was a time actually, I don't want to mention the date because otherwise you will guess my age. But there was a time where the pharmaceutical industry in Italy was suffering, and even the big pharmaceutical companies were closing down the research in Italy. So there were no availability. By chance, again, I came to Malaysia on holiday, actually, first time in 2001. And then here I was introduced by my friends, the Malaysian friends that I had met in London, a school of pharmacy. And therefore, I was introduced to the university here. And they noticed my interest, my expertise, because even in Italy as undergrad, I was doing a clinical trial under Professor Caccialanza. And therefore they asked me to join, first as assistant, and then as a research officer. And then I took the opportunity to actually further my studies. So I did my master and my PhD here in University of Malaysia in Penang. So I have to say that I'm very grateful to Malaysia as well, for the opportunity that I had here. So it was a long journey. Of course, I married a Malaysian. That goes without saying. Being an Italian, it makes it easier to move away from Italy. So this was very important for me. And so I could actually draw some comparison between the research in Europe, because I had experience in both Italy and in London, and with Malaysia. I have to say that actually in Europe we have a different approach. I mean, at least in my field, which is pharmaceutics, because we tend to work providing solutions for the industry, right? It's very difficult to invent new medicine because that requires billions of dollars investments, and that only the big pharmas can do. We have seen even with the vaccines, the joint venture between AstraZeneca and University of Oxford worked, but otherwise it's a private enterprise that actually moves enough money and researcher to develop new drugs. But nevertheless, the university has to provide expertise in terms of consultation, for example, or my field is a delivery system. So we can help in that particular field. As I said, the new drugs, I will leave to the pharmaceutical company. But my expertise here in Malaysia, I've seen it, I've done more than 100 clinical trials, and we usually work with generics. So we help either starting from the formulations, or we just do the bioequivalent study. So your generic is as safe, as good as the innovators. And that one is very good for the economy, so mainly for the patients, because they can trust the generics as well. So it is very important. Also from the point of view of the regulatories, because they actually they can trust the university to do this type of trials, because we have no personal interest. We just need to tell the truth, which is our result. As they say, numbers don't lie, but liars do number. So, so this is it is actually a type of parachute. It makes safe landing for the generic drugs.
Okay. So thanks a lot for this very nice story. So by chance you find a very nice place to work and to live, and to grow up a family. So very nice. And so the second question is about technology, because each of us knows, also we can connect. I'm not in Malaysia, can interview in Malaysia. Technology is strongly changing our life in all aspects. But can you tell us how technology is now changing also the drug synthesis and delivery? So how technology your work during the last 20 years?
Yes, as I said, my field of expertise is formulations. So but I'm not talking about myself in this case. So I can comment on that at least. What I'm saying is that in the pharmaceutical field, we need to aim for personalized medicine. So we are not just talking about nanotechnology, right? Okay. But we actually have to use the technology that we have and improve on the delivery system. For example, we have now, for personalized medicine, I mean that each patient will receive exactly their dose of drug that is needed for his condition, and this is very important. We have example. This is in your video. You will see part of the work that actually was done with the University of Parma, and we actually. I just want to give an example. There are drugs. There's a very common drug. It's called clopidogrel. It works very well for Caucasian population. It's a very good drug. But in the Asian population, it doesn't work. Only on 20% of the population works. So these are genetic differences that we need to address. Therefore, we need to personalize the medicine. We also aim at giving less in terms of amount, less drug in terms of amount, but also to give less administration. So give less time. If you many years ago you needed to take a drug, a patient needed to take a drug 4 times a day or 6 times a day. Now we can have preparation that actually we can implant, and for 5 or 6 years they don't need to take any drug because the drug is released at a constant amount for 5 years. This is particular for hormones. It is the technology breakthrough from our point of view. This is what we see from the technology point of view. We have the nanotechnology coming up very strong. We are actually not quite there yet in terms of, not in terms of research, but in terms of application for patients yet. They are not so common yet. But it's definitely the future. The future is coming and is in these terms. Yeah, we will eventually catch up. What is very important is to me is that to give the right dose, the right amount of drug to each patient, and reducing the number of times that. Then from the technological point of view, new drugs, in particular for antibiotics, they are very difficult. And we are running out of antibiotics actually. So my advice to everybody is use at least only when it's strictly necessary, right? So that I would like to stress that because otherwise we don't have any more weapons. As the COVID or pandemic taught us, the time to reach the market and the patient, therefore the patient, it can be in a safe manner. It can be shortened. Normally, to develop a vaccine like the one for the COVID, it would have taken at least 10 years. Now, they pushed so much that actually they managed to have it in 1 year, within a year. So that's to me is technology, and is many people working together. They can, many scientists from many different fields, they can work together. Now, for example, we are working in a combination of vaccine. So we want to have one vaccine that covers many diseases, so you need only one jab. Now in Italy, in fact, there's an Italian company that's actually developing even vaccine that don't need to be injected, so there's no more needles, so even better. So that's technology.
Okay, this is very interesting. Also, I like because when people speak about technology, is thinking something that is universal. But now you speak about technology, but also personalized medicine. What is also is amazing that you speak about the personalization can be not just on a single individual, but also on a single population. So different kind of drugs that you say have different effect in Malaysian population, different respect to Italian, and within a population, you have then to select person by person. So this is very challenging.
That's very, very challenging. Yeah, but with the knowledge of DNA, yes, it's very, very interesting.
Yeah. Okay, that's very nice. And we see that you are in the lab, and I know that you have a lab in the research in medicine to improve the human health. But nature, also nature, Mother Nature, can also provide us with very beneficial natural substance. Can you give us some example of this kind of,
sure.
of natural drugs?
Yes. It actually natural product, or derived, at least derived from nature, are more common than what you think. You know, there are many anti-cancer drugs. They come from flowers, actually. Vincristina. There are, you know, even your aspirin is actually from the salix, you know, the plant. So, you know, it is not new. Many of the antibiotics have the same original source, the statins as well, you know, they are in mushrooms. So nature is there, and we can actually improve on that. We had, I mean, with regard to my research now, we have done lots of study on tocotrienols, which is actually a particular form of vitamin E, where we actually proved that we could prevent fatty liver, which is a non-alcoholic fatty liver, which is a very common condition. We're actually the first one to prove that about 30% of Malaysians have fatty liver when we did the clinical trial. So we noticed actually that we could really improve. We demonstrated in a clinical trial that we can cure the fatty liver. So fegato grasso in Italian. So it is very, you know, was a breakthrough. And we also noticed that the same tocotrienols were able to protect the brain as well. So, and it's very peculiar because only this form of vitamin E can. The normal vitamin E, it could not perform the same activity. So it was demonstrated, widely demonstrated. We are also, we worked in the escape for artemisinin, so an anti-malarial. And this goes back to the technology. We modified the delivery system, and it was a project supported by the ICE, MISE. So it was from the Italian government, actually they started, and I was involved. We did the formulation, and actually was because artemisinin is a drug that is very good for protection against malaria, but for children, there's no formulation. So we prepared a formulation specifically for children. What happened if they market it or not, I don't know. But we did a study here in Malaysia and in Italy. So it was a very good project, very successful project from that point of view. Now, presently, I'm working on a kratom, right? Because now it's having a lot of interest worldwide. It is a local plant, so we noticed that there are actually it works very well. I have the study. I've done the study, but I cannot reveal yet. But it's confidential so far. But actually, we had the excellent results because we also prepared and extracted, purified, natural from the plant. We take from the plant, straight from the leaves.
Okay, very nice. So we will be back to you in 1 year to know the result of your research. But coming back to the present, unfortunately, we are still, let's say, in the pandemic situation. I hope we are in the tail of the pandemic. As you mentioned a little bit before, can you discuss a little bit more about this, how COVID-19 impact, or maybe can give new opportunities for pharmaceutical researchers?
Oh, yes. Actually, I was involved in a couple of conferences for the COVID situation. At the first one actually was in 2020 that we started, and where we didn't know, the humans didn't know, the scientists didn't know what to do, besides searching for vaccines. But when there was like the curiosity about, maybe other drugs that can be used, not to protect or use. So for the COVID, the best is vaccine. So please do take your vaccine. I want to stress. I want to stress. So get your booster. Follow up on that. Don't because it is very, very important. As I mentioned, I'm now also working on the 3 vaccines, 3-in-1 or 4-in-1. So, to give a more a wider protection. So basically, it's not just the COVID vaccine, but other like meningitis and so on, influenza, and we try to actually have a combination. So one jab fix it all. This is very important.
Okay, so we can look more positive for the future, positive instead of mental status, of course.
We go back basically to the personalized medicine. One shot, you don't need to go to the doctor 4 times.
Very good, very good. I think these topics are very fascinating, but we have to conclude this extremely interesting interview. So therefore, I want to thank again Professor Enrico Magosso for the many ideas and also information that he has provided us, despite only a few minutes. And I want to thank, of course, the Italian ambassador to Malaysia, His Excellency Massimo Rustico, who has promoted this initiative, and Professor Tommaso Arboscia, who also teaches in KL University, who helped us in realizing this interview. And I would like to conclude with a sentence of Leonardo da Vinci, since we start with Leonardo da Vinci, because as you know, Leonardo da Vinci was not only a great painter and engineer, but also a great scholar of the human body, anatomy and physiology. And the sentence is like that. So the soul is content to stay imprisoned in the human body, for through the eyes, all the various things of nature are represented to the soul. So we can conclude in this way. Thanks a lot. And see you next time, next year, for another Italian Research Day in the world. Thank you so much.
Thank you very much.